I don't think there is much change. Much has changed. It's quite the same right there. Just normal right there. Acute hemorrhage right there. Just the expected evolution follow-up appearance of such acute traumatic lesion. So it's unchanged, it's the same, it's as expected. That's what I'm going to write down here on the follow-up footnote of this report. So follow-up has been done. It's itching, my ear is itching. I'm itching my itch on my ear, and it still itches, so right there. Let's grab a cervical spine, right? CT scan of the cervical spine. Can't. It's not accessible. We could do a... let's see if we have anything here that could help us out. Yeah, out of interesting scans. Just good old... we have a orbit scan, CT scan of the orbits. It says it's a post-op scan, post-operatory, post-surgical of the orbits, and it has been done with contrast enhancement. I have no idea why. Let's see if I'm downloading. Am I downloading? No, just downloading now. It says here this patient has lost his right sight due to an accident, and he has lost his right ocular globe, his eye, and it's a follow-up scan. So I don't get why they did it with contrast enhancement, because if it's trauma, there is no need for such enhancement. But whatever, I wasn't there to say don't do it. So, oh yes, I know what happened. He was shot in the eye. Look at that. There are metallic fragments on a fracture of the frontal bone. There was also a medial fracture and consolidation of the medial wall of the right orbit. There is a very, very severe scar of such eye, a vertical scar right there. So this isn't your day-to-day trauma. This is a firearm, also another fragment right there, a firearm accident, assault of some sort, which led to a bunch of orbital fractures and the loss of the right eye. So the intrinsic muscles are there. For some reason, the optic nerve is also right there on the posterior portion of the prosthetic globe right there. So this is a prosthetic piece. This is a normal globe. They did use contrast enhancement in this case. Why did they do that? It makes no sense. But you know, who am I to judge just a very horrible? There was a fracture of the anterior portion of the maxillary sinus and the floor of the orbit and the medial portion of the orbit, the bones of the nose and the frontal sinus. It was a freaking disaster. Let's just go for an MPR, because the best plane to analyze a facial disease is the coronal plane. So indeed, we have a broken orbit floor, a broken medial wall, a diffusely enlarged orbital cavity, a prosthetic globe on the right. The muscles are fine. There is densification of the preseptal soft tissue with a bunch of anomalous calcifications and those metallic artifacts. There is also a fracture of the roof of the orbit. This is all the same thing. Let's just look for anything on the left eye and orbit. No, nothing major. Was there any brain damage? Was there any brain damage? I don't know. Might. Shockwave damage? No, it seems fine. So just a regular. Let's go for a sagittal view. Sagittal is fine. I like sagittal in this setting because there is diffuse deformities related to trauma, and trauma in itself is unique because every trauma setting is a proper disease on itself. It's really peculiar in nature. So there are fragments of sclerotic bone, maybe fragments of the bullet itself inside the right frontal sinus right there, and in the bone. So I guess we have as much as we can have to report this case. I'm just going to grab a normal template of the orbits because I really don't have a template for a major fracture like that. This isn't your everyday exam. Just going to say there is post-op signs on the soft tissues on the right.